Aloha, and half a day from my beautiful Western Pacific tropical island home of Guam. I pray that you're all doing well, staying healthy, and staying safe under these challenging circumstances. I'm Joe Davis Fleming, HCAD graduate class of '86, currently serving as a regional public health advisor, CDC, and WHO liaison for grant-funded programs focused on communicable diseases on behalf of the Pacific Islands Health Officers Association, also known as PHOA. PHOA is a nonprofit organization led by and representing the collective interest of government healthcare leaders of the U.S. affiliated Pacific Islands, or USAPIs. PHOA's mission is to improve the health and well-being of USAPI communities by providing, through consensus, a unified, credible voice on health issues of regional significance. The USAPIs include the three U.S. flag territories of Guam, the Commonwealth of the Northern Mariana Islands, and American Samoa, and the three freely associated states, or independent nations, that have a special compact relationship with the U.S. They are the Republic of the Marshall Islands, the Republic of Palau, and the Federated States of Micronesia. The USAPIs are populated by more than 500,000 people who live on hundreds of islands and atolls, spanning millions of square miles of vast ocean and spanning 5 Pacific time zones. It is my pleasure to share some thoughts and Pacific Islander perspectives on making lemonade when life throws lemons along your path. In other words, I pose this question to you. What will be your new normal post-global pandemic? Pacific Islanders suffer from health disparities and socioeconomic challenges that put them at higher risk for contracting severe acute respiratory syndrome, coronavirus, or SARS-CoV-19. Many Pacific Islanders living in multi-generational homes have little opportunity to social distance themselves from others, which adds to the challenges of COVID prevention. We also continue to be challenged with environmental and communicable disease outbreaks annually, like dengue, measles, and Zika, in addition to natural disasters like typhoons, earthquakes, tsunamis, and volcanic eruptions. Regional USAPI COVID challenges include limited access to quality health services due to a lack of proper infrastructure, equipment, and qualified personnel. In a pandemic situation, this can especially pose a problem of accessing care if the number of infected people significantly increases beyond our healthcare system capacity. The majority of USAPIs do not have adequate laboratory equipment needed to analyze the test on site, leading to difficulties in identifying new cases of infection on a timely basis. Therefore, test samples must be sent to regional reference labs like in Guam, Hawaii, and other countries in the region for analysis. The USAPIs, especially Hawaii and other Pacific Island nations, are frequently visited by tourists. This represents a significant risk due to frequent movement of people to and from these respective jurisdictions, even though restrictive measures have been put in place, as well as placing our fragile local economies at risk. Up until mid-March, most of Guam's travelers came through direct flights between Guam and Hawaii to our east, Japan to our north, Philippines to our west, South Korea and Taiwan to our northwest, as well as indirect flights originating from Papua New Guinea, Australia, and New Zealand to our south. However, Guam and other US APIs have some of the lowest COVID infection rates in the world, averaging 1% or less for new cases and hospitalizations, even when we're providing free community-wide mass testing. Guam, with an estimated population of 169,000, has experienced no more than 5 COVID-related deaths since March. Other US APIs, like American Samoa and Palau, have yet to report their first confirmed infected case. Proactive emergency response planning as far back as mid-January and regional support of CDC and WHO prescribed prevention guidelines like face mask wearing, social distancing, sanitary hygiene practices, self-isolation and quarantine of incoming travelers from high-risk areas, robust contact tracing, gradually phased business reopening procedures, and creatively changing the way we conduct daily businesses and services, as well as everyone in our communities doing their part to prevent the spread of COVID, can be credited to our successful containment efforts. This global pandemic has exposed critical vulnerabilities in our country's healthcare system, especially socioeconomic disparities for accessing health services, as reflected in disproportionately skewed higher infection rates amongst medically underserved rural communities, majority communities of color, and families living in poverty. But this pandemic has also created promising emerging new healthcare opportunities, including significant expansion of telehealth, improved disease prevention and infection control, communicable disease outbreak response strategies, virtual online business meetings and social activities, and distance learning, leveraging previously underutilized technologies and resources. Who knew that Skype, Zoom, LinkedIn, Facebook, Netflix, Hulu, and similar other business, social, and recreational online platforms would reflect our new normal way of life? From the formation of quarantines, as many businesses and government agencies have embraced new work from home practices, to Zoom bombing of rapidly growing virtual social event offerings, to longer queues at drive-through restaurants, to the reemergence of drive-in theaters, Rona has created a newly emerging pop culture in 2020. I wish to conclude my presentation by congratulating the Trinity class of 2020 and our newest members of our Alumni Association. Learn well from this once-in-a-lifetime experience and make the most of the many career opportunities that await you as we, together, make lemonade for a better global society and a brighter future ahead. Aloha.